Our next presenter is Dr. Kheriaty. Dr. Kheriaty is Chief of Ethics at the Unity Project, Fellow at the Ethics and Public Policy Center and the Zephyr Institute, and Senior Scholar at the Paul Ramsey Institute. He was formerly Professor of Psychiatry and Director of Medical Ethics at UC Irvine School of Medicine and Ethics Committee Chair at the California Department of State Hospitals. He has testified before the California Senate on health policy and consulted on COVID policies for the University of California and the California Department of Public Health. Dr. Kheriaty.
Thank you, Senator, for that introduction, for this opportunity to speak. I want to talk about medical ethics because I'm concerned that many of our pandemic policies have ignored foundational principles of medical ethics. During the initial lockdowns in 2020, hospitals sat empty for weeks. Hospital staff, and including doctors, were even sent home as we had canceled surgeries and other procedures and were waiting for an influx of COVID patients that did not arrive until months later. Healthcare systems, spurred by perverse payment incentives from CMS, Dr. Marik averred to just one of those, there are several others, caused our healthcare systems to focus narrowly on one single disease. This had the effect of, for example, biasing our COVID hospitalization and death counts. We've heard quite a bit about that in the media in the last couple of weeks, but people in this room have known about that for 2 years. We effectively abandoned patients that were suffering from other conditions and had other medical needs. The disastrous fruits of this myopia include an unprecedented 40% increase in all-cause mortality among working-age adults 18 to 64 over the last year, most of which, 2/3 to 3/4, depending on the state, was not related to COVID. Actuaries tell us that a 10% rise in all-cause mortality is a once-in-200-year disaster. This was a 40% rise. Our public health establishment has no answer for what caused that. The ethical principle of free and informed medical consent, guaranteed by the Nuremberg Code, the Helsinki Declaration, the Belmont Report, commissioned by our own federal government, the Common Rule in federal law. This basic principle of medical informed consent was abandoned, for example, when vaccine mandates required experimental EUA vaccines. The common good argument to get vaccinated in order to protect others quickly fell apart with clear evidence that the COVID vaccines do not prevent infection or transmission of the virus. Yet these one-size-fits-all mandates for vaccines remained. Meanwhile, public health authorities ignored natural or infection-induced immunity, even though this remains our primary path out of this pandemic, especially as vaccine efficacy declines with time and with new variants, as we've seen clearly with Omicron. Transparency, which is a central principle of public health ethics, was likewise abandoned. Along with several colleagues, some of whom are in this room, I had to file a FOIA request to obtain the Pfizer vaccine clinical trial data from the FDA, which the FDA is required under federal law to release on the day in which this vaccine was authorized. The agency came back saying that it wanted 75 years to release this data, the data for the vaccine that had been mandated for millions of Americans. Data that took the FDA only 108 days to review. Fortunately, the federal judge just ordered this data released in 8 months. Thousands like me have lost our jobs for declining a novel injection whose safety and efficacy data still remains hidden. My firing from the University of California, where I served for 15 years, my entire professional career as a professor in the School of Medicine and director of their medical ethics program, came shortly after I challenged the constitutionality of the university's vaccine mandate in federal court, a case that's ongoing. The scientific method also suffered by a repressive academic and social climate of censorship and silencing of competing perspectives that we've heard a little bit about already. I certainly experienced that at the university. This projected to the public the false appearance of a scientific consensus, a consensus that was often very strongly influenced by economic or other political external interests. Finally, our government and public health authorities have still not defined the thresholds for this state of emergency that is renewed every 3 months. The supposed legal justification, this state of emergency, this public health emergency, for all the burdensome COVID countermeasures, right, a term that's emerged in the last few months with the militarization of public health. This is not a medical term. Physicians, scientists don't talk about COVID countermeasures. But these COVID countermeasures, the infringements on our civil liberties, the censorship of dissenting voices, all justified supposedly in the name of a public health emergency, the criteria for which has never been clearly defined. The assumption of emergency powers by both elected officials and unelected bureaucrats therefore continues indefinitely, with no end in sight, without any critical scrutiny or appropriate checks and balances. Thank you.
Thank you, Dr. Kheriaty.